Good afternoon, everyone. My name is Keisha Daniels. So it's about 3 o'clock and we are about to begin. We just want to give a couple of minutes for those who are joining and signing in, and then we will begin. So thank you so much. Welcome, and we're so glad to have you here today. All right, once again, good afternoon, everyone. Thank you so very much for being here today. I am very delighted to have you all here. Um, and once again, thank you so much for joining us. So it's about 3:02, and so we're going to begin. At this time, I would like to ask everyone to please remain on mute. And we are going to begin a short and brief meditation to get our minds ready and open to receive this wonderful information that has been prepared by our special guest speaker, Metro Plus Health's own Dr. Javier Garcia.
This is a 2-minute meditation to ground yourself emotionally, mentally, and energetically. Grounding yourself is essential to be fully present in your body, to clear your mind, calm your emotions, and strengthen your instincts. Grounding is the ultimate connection of mind and body. Let's begin. Find a comfortable seated position and gently close your eyes. Begin to take awareness of the present moment. Place one hand on your chest and the other on your abdomen. And with every inhalation, belly rises, then chest rises. With every exhalation, chest falls, belly falls. Inhale, belly rises, chest rises. Exhale, chest falls, belly falls. And we're going to continue taking 20 deep, long, and smooth breaths. Now visualize yourself seated in an outdoor location that has brought you peace and calmness. Take 100% of your awareness to this space. In your mind's eye, begin to grow roots out of your legs and feet into the earth. Grow thick, sturdy, and strong roots through the earth's crusts. Feel yourself 100% connected to your roots and your body. Deep breaths. Now place both hands over your heart and set the intention that for the remainder of your day, all your thoughts, emotions, and mental awareness will be grounded, stable, and calm. Thank yourself for taking a refreshing 2-minute mental break. And slowly begin to open your eyes and go forth with a calm and collected demeanor for the remainder of your day.
Thank you so very much again for everyone taking 2 minutes to have a mental break and just relax and just be ready to receive this wonderful information from our own special guest speaker, Dr. Javier Garcia, who is a bilingual psychiatrist with extensive experience in acute care and consultation psychiatry. He received his medical degree from Downstate University Medical Center, followed by residency training at Sucker Hillside Hospital. In addition to his medical training, Dr. Garcia holds a Master's of Academic Medicine from the University of Southern California and a Master's of Medical Management from Carnegie Mellon University. He is also certified in EMDR and intensive psychoanalytic psychotherapy. Currently, Dr. Garcia serves as the Behavioral Health Medical Director of the Mainstream Plan right here, Metro Plus Health. He has also worked as a department chair of psychiatry at Northwell Health. He is double boarded in addiction medicine, allowing him to address both the mental health and substance use needs of his patients. Dr. Garcia has been a speaker at national conferences ranging from the American Psychiatric Association to the Mental Health Services conferences, as well as as well as a local invited speaker at hospitals' grand rounds for diverse topics in mental health. Dr. Garcia is passionate about education and committed to transforming healthcare to improve patient outcomes. He is focused on decreasing stigma, facilitating access to care for a culturally diverse population, and integrating mental and physical aspects of health. Without further ado, I would like to introduce to every one of you our special guest speaker, Dr. Javier Garcia.
Thank you, Keisha. I'm feeling more relaxed after that meditation. I hope everyone else is. Good afternoon, everyone. My name is Dr. Javier Garcia, and I'm delighted to be here with you today to discuss a topic that's important to me and important to everyone, which is our mental health. Today, we'll start with some general background, and then I'll discuss how to find help and support when dealing with your mental health problems. And we'll talk a little bit about self-care strategies. And at the end, I'll have a list of resources. Many of the things that I'll comment will be um, on the last few slides as resources. So this first slide, it's really hard to talk about anything these days without talking about the pandemic that we've all gone through. It's had a worldwide impact on everyone, on every industry, and we've all been personally affected. Healthcare industry is no exception, and neither is the impact on our mental health. It's actually led globally to a higher rate of mental health problems. And there's a lot of reasons for this. Some of the causes are the high levels of uncertainty and loss and the social isolation that came with the pandemic. And even before the pandemic, the number of people in the United States experiencing mental health problems was high and on the rise, especially among young people, and it's gotten worse throughout the pandemic. The number of people affected by anxiety and depression has risen, with the most dramatic effect on our younger generations. One review estimated something like 53 million cases of depression and 76 million cases of anxiety caused just by the pandemic. That's apart from all the other factors. There's been a rise in drug use and opioid overdose, and these numbers probably even underestimate the scope of the problem because mental health problems, although it's improved, it's still pretty stigmatized, and people that are likely to be deeply affected, such as those in jail and homeless, are often not the people that are included in these studies. But I don't want to be all just doom and gloom. It's not all bad in a sense that if there's any silver lining to these years, it's been that it's really shown a spotlight on mental health. The COVID-19 pandemic focused or brought greater focus on mental health in the US, and it's driven a renewed interest in the effects of the social and psychological experiences such as loneliness, social isolation, stress, and uncertainty, and how that affects our emotional well being. It's also made mental health a national priority, and it's led very positively to an increase in openness in discussing mental health and recognition that this is something that we can and should be talking about because one way or another it affects all of us. It's led to an expansion of telehealth services, mostly on the mental health side. At least those are the services that continue. And while not everyone has a stable internet connection, so that's important to keep in mind, it has helped a lot with accessibility and convenience. So the point of this is you're not alone. So this is the point. Mental health is important for everyone. If you are dealing with a mental health issue, you are not alone. And a lot of these numbers come from before the pandemic. So 1 in 5 adults, experience a mental health issue each year. So that's not in their lifetime. That's each year. 1 in 20 adults have a serious mental illness each year. 1 in 6 youth have a mental health disorder each year. 50% of all mental illness begins by age 14 and 75 by age 24. And suicide is up there at number 2 as leading cause of death among kids aged 10 to 14. So again, this is a breakdown of mental illness by prevalence and by group. And so you can see that it really does affect everyone, from whether you're non-Hispanic, whether you're Hispanic, multiracial, lesbian, gay, and bisexual group has a, that could be as high as 50%. And again, it's uniform how conditions affect everyone. I mean, schizophrenia, although that seems low, that's 1 out of every 100 people. You can see things like anxiety disorders. The annual prevalence is 20%, so that's again one out of every 5. Depression, PTSD, you've probably heard of these, bipolar disorder, and OCD, are some of the conditions that affect everyone. Our mental health doesn't occur in a vacuum. Our physical and mental health are interrelated, and you can see that. And these are just some of the figures, just to have kind of a small cross section of the way these things interact. But 40% people with depression have a 40% higher risk of developing cardiovascular and metabolic diseases. People with serious mental illness are twice as likely to develop these conditions. 33% of U.S. adults with mental illness also have a substance use disorder. So that's 19 million people in this country. The rate of unemployment is also higher if you have a mental illness. You have also a significantly more likely, higher likelihood to drop out of high school. And students with age 6 to 17 with mental, emotional, or behavioral concerns are 3 times more likely to have to repeat a grade. So it really has a serious impact on, all facets of your life. So the question is, when I need help, where do I get it? First of all, if you are in a real crisis and you have thoughts of things like hurting yourself or hurting others, or you're really feel like you're spinning out of control, there are places where you can get immediate help. In life-threatening situations, the way to get immediate help is to call 911 or go to the nearest emergency room. A lot of emergency rooms have specialized psychiatric areas, or have access to a psychiatrist either in person or through telepsych, so you can get connected very quickly if you are in a crisis. If you're suicidal or in emotional distress, you can also call 988, which is the Suicide and Crisis Hotline. You can actually call or text, and you'll be connected immediately to a trained crisis counselor. The Lifeline provides 24-hour confidential support to anyone who's in a suicide crisis or emotional distress. Using this number, you can even reach a LGBTQI affirming counselor by texting Q to 988 or by calling 988 and pressing 3. Again, I'll have all this information at the end. If you're a veteran, if there's a disaster distress line, if you're experiencing emotional distress related to any natural or human disaster. And there's even these, you can even try to connect people with help if you see something concerning in social media. Not a lot of people know this, but Facebook and Instagram and all these social media companies have a safety team. So when you can reach out to the safety team and they can connect the person with the help they need. And again, these will be at the end in the resource slides. So finding the help you need. So when do we need? I mean, certainly if we're in an immediate crisis like I just described, and you have to seek help immediately. But sometimes you have a little more time. When should we seek help? You might find yourself constantly worried. You might find yourself trapped. You aren't getting better using other approaches. You feel you can't handle things alone. And these things are affecting your job, your relationships, your sleeping, your eating. It's also interesting because sometimes people who know us well and we trust can see problems better than we can. And this is also the case for some conditions, that sometimes people on the outside see it when we don't ourselves see what we're going through. So you might consider getting help if someone who knows you well suggests that you do, or if you have an untreated problem with substance abuse. These are only some of the symptoms. You may have other things that are concerning to you. So seeking help. So treatment for when you're dealing with your mental conditions usually includes therapy, whether it's virtual or in person. It can include medication. or a combination of the two. And there are many ways to look for a professional. And if you have a primary care provider, that might be the first step. Primary care provider, your medical doctor, can do the initial mental screening and refer you to a mental health professional. So if you have a checkup for, regular checkup, you might consider bringing up your mental health concerns and asking for help. And so, but there's other ways, I mean, to be connected to a mental health professional. There's, again, I don't want to reiterate, but all these will be linked um, in the resource pages on the back. You might have, there's some federal agencies, for instance, that for identifying mental health professionals. They include agencies like the Substance Abuse and Mental Health Services Administration, SAMHSA. They have a health helpline and online locator for mental health services. There's also the Center of Medicare and Medicaid Services, or CMS, for finding Medicare providers if you have Medicare. And the U.S. Department of Veterans have tools for finding services for veterans. There's also national organizations, and I think it's important to look for ones that are reputable. But there's many reputable advocacy and professional organizations with tools and directories for finding someone near you. There's also state and local agencies, and in our case, the New York City Health website has some very good local resources. And if you have an insurance like MetroPlus or some other insurance, um, it's a good idea to call the representative of your insurance company and to get a list of local providers that are covered by your insurance plan. Your health insurance company may have an app or an online database that you can use to find participating providers in your area. You may also consider calling um, a general line to see if you qualify for an insurance or getting more information about your benefits. If you're a student, a good resource for you is the student center, or the school usually has a health center or peer support group. You can also search your school's website for mental health resources. And certainly if you're a job, another sometimes overlooked resource is your employee assistance program, or EAP. These are usually free and confidential services that your company pays for, and they can help employees with issues related to mental health, drugs, alcohol use, grief, or trauma. There is also community health mental health centers that offer counseling and other services on a sliding scale based upon your income. So it really, if you have a high or low income, I mean, you can look for this as a resource. Of course, word of mouth can come from friends and family. If you don't have health insurance, or the insurance does not cover your mental health, you can look for other resources as well. Sometimes there's pastoral counseling, for instance. Your place of worship, if you follow religion, can put you in touch with a pastoral counselor. Um, Certified pastoral counselors are specially trained ministers, rabbis, and imams who are recognized by the religious body, and they can help in this regard. And there's also support and self-help groups. Things like Alcoholics Anonymous, National Alliance on Mental Illness are examples of peer and support group. Um, Again, it's important to only, because there's a lot of groups that are not reputable, and we'll talk a little bit about how to check that yours is. But red flags are for these online sites are things that sites that promise a miracle cure for your disease or condition, or are pressuring you to purchase services or products, or suggest you stop your traditional care. These are the kind of things that you should avoid. So, who are the mental health professionals? And these are kind of the major categories, just to kind of get an understanding of the landscape. The psychiatrist is someone like me who is a medical doctor who's had training in psychiatry after medical school. Psychiatrists can do psychiatric evaluations. They can assess your medical conditions as well as your psychological issues. And some psychiatrists provide psychotherapy and can prescribe medications. Psychologists, on the other hand, has a master's degree in psychology, and they don't prescribe medications, but they do psychological testing, evaluations, and are also trained to treat emotional and behavioral problems and mental disorders. A social worker is another possibility. They have a bachelor's or master's or doctoral degree and are licensed to practice social work. They won't prescribe medications, but they can assess and treat psychiatric illnesses and do psychotherapy. Then we have a psychiatric or mental health nurse, and these are nurses with advanced training that can do case management, and in some case states like New York can also prescribe medications like psychiatrists. And then we have licensed counselors who have a master's degree in psychology and also provide some counseling services. Before you go for a visit, it's useful to have some idea of how to prepare for one, and some questions you may want to ask. You want to make sure that the person that you're seeing has a training and experience in your area of concern. This could include alcohol, depression, gambling, domestic violence, and you want to make sure that you're seeing a licensed professional who has, and you can also check to see if that person is licensed in your state's division of occupational and professional licensing. It's also important to keep in mind that you have a right to choose the provider who meets your own cultural concerns. So, for instance, if you're a woman dealing with domestic violence issues, you should feel free to ask for a female therapist if that's your preference. Um, but a therapist doesn't have to be like you also to be able to help you. Which is something to keep in mind. It's important that you feel comfortable talking to the person, and that they care about you. And you shouldn't get discouraged if it doesn't work out with the first person. Sometimes it takes a few to really connect with a person that you feel can help you. And these are some of the other questions that you might consider asking. Something practical like, do you accept my insurance? How much will treatment cost? It's useful at times to prepare a list of medications, consider bringing a friend, and always you're only going to get as much help as you are honest with the therapist or professional that you're speaking with. And again, the same thing. I've already mentioned some of these things, but it's important to be prepared to get the most out of your online health support group if you found a group that you find useful. And you can find support groups by visiting for all kinds of conditions: depression, anxiety. There's also support groups for family members. um, you know so some things to consider when you're looking at a group is, is it a group with a number of different people posting? It shouldn't be just one or two people or a small group. Do they seem like they're truly helping each other? Do the members seem caring? Do you feel like you can relate to the group? And again, try to avoid groups that have advertising or products as a cure, and be wary of those that kind of have something like that. The best way actually to find a reputable group is there are reputable resources, and I link some. For instance, the ADAA, which focuses on improving quality of life for people with depression, anxiety, PTSD, and related disorders. Um, the National Mental Health Consumer Self-Help Clearinghouse is peer-run and fosters recovery, self-determination, and community inclusion. You have the DBSA, which again is a good resource for depression and bipolar illness, and NAMI, which is another excellent peer-led group for family members, caregivers, and loved ones of people with mental illness. This is just an example that I think is useful to talk about. Sometimes it's not us who needs help, but we might need to take a role in helping others. An example is helping maybe a loved one with memory loss, so that it's a problem that you may see and the person may not have that same awareness. And memory problems, if you notice it, can be a sign of more serious illness like Alzheimer's or another kind of dementia. So these are some of the things that if you see, you might consider connecting that person to a healthcare provider. Like if they're not able to remember familiar things or people, if that person is more forgetful about, remembering recent events, if they have trouble doing familiar things that they're usually, have no problems like cooking, or if they're getting disoriented, driving or walking in places that were formerly very familiar. These might be signs that this person needs a thorough, workup and connection with a mental health professional who might need to do some a thorough medical workup, might do some imaging, because it might be a whole host of problems, some of which can be addressed with the proper medical care. So I'm not going to spend a lot of time here, but this is just some tips for if you find yourself in a position of caring for someone with memory issues. Um, some things that you can do is be patient, keep new information simple, give verbal cues rather than questions, make sure they're on a regular routine, and seek help from family and friends. I'm going to go on to the third part of the presentation, which is, the importance of our own self-care and managing our own mental health, and some tips on how to do that. So many of us do have physical health goals, but you know, uh, our mental health goals are important as well. So I'm just going to provide some tips that are kind of easily applicable. There are some of these and some that might take a little more work. But a few simple tips are to remember to prioritize your self-care. So this is just having kind of you know, the foresight to spend some time during the day when you have a quiet moment with a book, a walk, or you find a way to do something that you enjoy. Sometimes it's easy to get swept away with our, daily routines. It's also important to keep maintaining our routines, having a regular sleep schedule, regular activities, because consistency can give us a sense of stability. We also sometimes need to make sure we set realistic expectations. It's important to it's important to embrace our imperfections and focus on the moment to prevent burnout. Connection is also with others is also very powerful, because loneliness, as we found during the pandemic, and is can be overwhelming. So it's important, if you have a time, to reach out to your friends and family, even if it's just virtually, because social support is a powerful tool for our own well-being. And even finding small ways to help others is helpful, because it can give us a sense of purpose. So it doesn't have to be anything, doesn't have to necessarily be anything deep, but just even having positive interactions with some people as you go through life can be very helpful. So I think this is a little bit about the mental tips I just talked about. Another one that seems to be getting some evidence is trying to reduce your social media intake. It's interesting because uh, having a social media break, or not spending a lot of as much time, if you are one of those people that spends a lot of time in social media, actually seems to be related to having less anxiety, depression, and a greater sense of well-being. So that's another thing you might consider. And this is very relevant to the little practice we had in the beginning. Meditation is one of those evidence-based practices that do have real benefits to our mental health. Constantly replaying in our mind our daily problems can affect your mental and physical health. So meditation, even taking a few minutes, as we did earlier today, can be very helpful. To get the most out of it, the recommendation is to take 10 to 20 minutes a day. And if we can do mindful meditation, like we did earlier today, often that involves sitting, sitting in a place without distractions, and focusing on your breathing, maybe noting your thoughts as they come and go, and then returning to your breathing and trying to do that for 20, 30 minutes a day. Or if that is not your thing, you might have a benefit from a more active or moving kind of meditation, like yoga or Tai Chi or walking meditation. So believe it or not, practicing optimism can actually make a difference in your life. There's been a lot of studies suggesting that optimistic people tend to live longer and have better physical and mental health. There is even a whole psychology called positive psychology, which is a relatively new branch of psychology that is focused on, what are the traits and features that contribute to a sense of happiness that comes from this. So it's interesting that this idea that optimism can lead to better health has been studied, and it shows a wide range of impact from, everywhere from decreasing heart disease to improved cancer outcomes to pregnancy outcomes to pain tolerance and a whole host of topics. The message is that having a positive attitude can boost your physical health. Of course, changing from a pessimistic mindset to an optimistic one is not easy and it takes some work. So I can start off with a few tips. One is to try to think about positive thoughts about yourself and others as you go through the day. As I said, also consider limiting your usage of social media sites where you tend to compare yourself with others who post on those sites, and it's usually unrealistic. Try to find good in situations when you're going through them. When facing a challenge, um, don't only think of the negative outcomes, although that's, sometimes that's part of it. Also, notice the positive ones. And a few other things are even trying to improve your physical health, having good sleeping habits, like I discussed before, can improve your outlook. Challenge your mind every day by learning something new. This is also another way to kind of improve your outlook. This can include learning about yourself and your family history. So, in conclusion, I want to thank you for joining me today. I think, it was a kind of a fast overview, but we've talked a lot of important topics of mental health and about how to find help and support. What I'd like you to remember is that you are not alone in your journey. There are resources and options available. It's important to reach out, take care, be kind to yourself and others, and prioritize your mental health.
So one, at this time, thank you so very much, Dr. Garcia, for that wonderful presentation and the helpful information, especially during these challenging times. So once again, thank you so very much. What I would like to mention, if anyone is on this call and interested in enrolling into our wonderful Metro Plus health plan, please feel free to reach out to our general customer service number, which is 1-866-496-6636. Or of course, we can be reached at www.metroplus.org. Once again, our general customer service for enrolling into our Metro Plus health plan is 1-866-496-6636. What I would like to do in an effort to respect her valuable time is I do believe we have the VP of behavioral health on the line, which is the wonderful and vivacious Karen Leonard. Would you like to offer up some words at this time?
Okay, hi. No, I just wanted to thank everyone for joining and thank Dr. Garcia for his great presentation today. I think for Metro Plus health plan being like the city's health plan, and anybody that's living in the city and kind of have seen, what has happened since the pandemic, we are completely dedicated to make sure that we meet the needs of all of our members, but specifically members that are struggling with behavioral health, so everyone can reach their recovery goals, right? Everyone wants either work or school or love or friendship, of all those normal things that you want in life. And we are here to support people reach those goals and get the mental health treatment that they need. So I'm glad you guys all could join today, and hopefully you learned some techniques. And I love the end of like, just be kind to yourself. I don't think we all do that enough.
Well, thank you so very much, Karen. We greatly appreciate having your presence here. Once again, thanks again to Karen Leonard, who is the Vice President of Behavioral Health here at Metro Plus Health, and of course, to the wonderful Dr. Javier Garcia. So at this time, we would like to open up. Please feel free to unmute, or please feel free to text in the chat any questions that you may have. Remember, don't be afraid. We're here to break and stop stigma. And also, it's okay to not be okay. Do we have any questions?
Hi, yes, I have a question. This is Michelle Dominguez. And I was really interested to read recently the articles that were published around the new study that came out that linked anger with heart disease. And I was wondering if Dr. Garcia had any recommendations for New Yorkers who are constantly angry with something. How can we bring that under control, and to explain maybe a little bit about more about that relationship?
I mean, anger is not one of the emotions that we generally consider positive, although it certainly sometimes anger does have a side that it can activate us to do things that are positive. But it's a stress on our body, anger in general. You know, if it's leading out to violence or to domestic disputes, I mean, you may consider there are anger management groups that can be very helpful. Otherwise, many of these tips that I just discussed here today, um, from ranging from meditation to having keeping a regular schedule to can be very helpful, kind of to create a distance between the emotion of anger and kind of being able to observe it and finding ways to center ourselves in those times.
Good question. Thank you so much, Michelle. We do have two questions that we received anonymously. The first question is, are mental disorders genetic? I feel like I have my father's negativity / anxiety.
Well, I mean, that's $1 million question. It's and I don't think it's an either or. It's not a nature or nurture. It's both. Some things are highly genetic. Things like bipolar disorder runs in families, anxiety runs in families, even our tendency to abuse substances runs in families. But we can't also discount the environment that we grow up in and the models that we have. Certainly surrounding ourselves, the models that our parents and our siblings and the environment we grow up have tremendous impact. So some disorders are certainly more genetic than others, but nature and nurture play a role in both.
Okay, great. Thank you so much for that response. We have another question, which is work burnout a real thing?
Yes, that is something that is very much in the media, and we've seen it. It's not an invention. I think it's very easy to get wrapped up in work. It's very easy to neglect our mental health. And so that's why talks like this and finding ways to take care of ourselves and self-care are extremely important. Modern life has brought more pressures, not less. And that I think is manifesting in burnout. And I also think we live in a society where we're increasingly disconnected from our own social support systems and having real connections with people in our lives, and all these things I think are factors.
We have another question in the chat, which is, what is the appropriate way of handling a loved one who is experiencing voices in her head and seeing things that are not really there?
Yeah, this is a person who might be in a severe crisis, kind of what we discussed before. If they're in an acute risk to themselves, because sometimes these voices are saying extremely negative things, they may be dealing with symptoms of schizophrenia, bipolar disorder, it may be substance abuse. It's hard to know without a professional evaluation. So, if it is a crisis, you might consider taking the person to the emergency room for an emergency evaluation. That sounds like it's potentially a crisis.
Thank you so much. And so another question in the chat is, when receiving mental health therapy, how does the treatment differ when receiving therapy from a social worker, psychologist, or psychiatrist?
It can be very different, or it may not be, because there are there's different types of therapy. For instance, some anxiety conditions may be better addressed with cognitive behavioral therapy. So it's whereas others may be better addressed by someone trained in dialectical behavioral therapy. Or some conditions you need, I discussed before, a combination of medications and therapy. So, for instance, a psychiatrist can prescribe medication, but not all of them do therapy. Sometimes you need to have a therapist or separate from that. So it really depends a little bit about what condition you're dealing with, whether you need medications, for instance, and what type of therapy would be best suited to the condition that you're experiencing. Someone, for instance, who has trauma might benefit from seeing someone trained in EMDR, which is a trauma-based therapy. I'm just throwing that as an example, but it's really about connecting the person with the appropriate resources.
Thank you so much. So I just want to open the floor one more time to see if someone would like to unmute or text in the chat any additional questions at this time.
And another resource, just so folks are aware of, especially like if you're not sure what treatment they may need, or you need help getting connected, that everyone's aware, right, of 988. So 988 is kind of the new, I want to say it started last year. It's kind of the alternative if need, right? Like you can, it doesn't feel like an absolute emergency where you have to call 911, but you want to speak to somebody about a behavioral health condition, or kind of next steps or resources. And this is available across nationally. In New York City, it's Vibrant that covers, but the 988, you can speak to a crisis counselor. They have a whole database of the different services available in New York that they could recommend or give you different resources too.
And that
You
is in the resource slides, which is a great point. And you can also text if that's easier for
Yep.
you.
Yep.
What's in there?
Yes, so we do have another question in the chat, which is just as Karen stated, are you supposed to seek treatment in a certain order? For example, go to a therapist before a psychiatrist.
There's not necessarily an order to it. Sometimes there is a scarcity. Unfortunately, it's because of sometimes it's difficult to get an appointment with a psychiatrist, and there's often, but not always, a longer wait time. So it's useful to connect with a therapist first. But there's not necessarily a right order to this. Medication and therapy can both be part of your treatment.
Great. Well, thank you so very much, Dr. Garcia. I'm just going to one more time ask if someone has any additional questions or would like to place something in the chat.
I have one, Keisha and team. Dr. Garcia, thank you so much for being a part of this webinar, and it's amazing to have you and Karen as well. Thank you. Wanted to double check and see in a lot of cultures, especially with men, it's hard to seek out mental health help. It's looked down upon as a weakness, right? And just speaking as a Latino, there are a lot of men in my family that I think could benefit from seeking some resources and some help. What's the best way to sort of encourage men that are really sort of doing the best that they can to sort of do it themselves, and and just deal with it themselves, and not make them feel like they're going to be less than just by seeking out help?
That's a great question. It's I don't know if I have an easy answer to that, but I would urge family members to also seek resources for themselves. For instance, NAMI is a great resource for family members, and they can sometimes help provide support and information on how to do how to help someone in your life who you think needs help, but isn't for cultural or other reasons isn't reaching out and connecting. But I think this is a great question, and it's probably a large topic that we can and maybe should spend some time talking about, because there's no easy answer to that. If you have anything else, Karen, but
No, I mean, I think specifically on just like cultural barriers and how people see behavioral health, both substance abuse and mental health. I think that's why you will also see so many Stomp the Stigma campaigns, right? It's trying to infiltrate different groups of like how people view mental health or substance abuse treatment, right? We need to get to a place where we look at mental health and substance abuse as a medical condition, right? You need treatment for your diabetes, you're going to go see a doctor. You need treatment because you're feeling anxious and you're not sleeping at night and you're not enjoying things you used to. That's a medical condition that you need to go get treatment for. So I think it's like step by step as a society. I think COVID, if anything positive that came out of COVID, hopefully it reduced the stigma about seeking help, right? Especially for all us New Yorkers, right? That March and April, if probably 10 out of 10 we're feeling anxious or depressed, not just 1 out of 5. But I think we need to do better, and we need to continue to like have talks like this, and you kind of talks like this also like normalize that getting help, it's okay. And it's okay to say you're not okay and that you need help. Just as you would say, my blood pressure up and I gained weight, like that's not okay. I need to get some help. And that's where we just have to keep moving along and like talking about it and normalizing. This is a condition that needs help, like you would a broken arm.
Absolutely, I agree. And thank you so very much, Elkin. That's an absolutely wonderful question. I am a firm believer of stopping stigma. Some people know, some people don't know. However, last year I was very blessed to receive the NAMI Volunteer of the Year Award. And I didn't take it lightly. And I attended the Family to Family class, which at that time was 12 weeks. It is a class that is free. It is, I believe at this point now it's 8 weeks, and I believe you can do it in person or virtual. And that was through NAMI, which is the National Alliance on Mental Illness. They offer free support groups. They offer all kinds of support groups. And also what I do is once a week, I have a family match mentee that I speak to for about 30 minutes to 60 minutes per week. Just to discuss things that we just, like a question that we just asked. And one of the biggest things is how do you even approach that conversation? How do you break the stigma? And yes, I can say there are various cultural barriers. NAMI also offers support groups for AAPI as well as for Black Minds Matter, which I really enjoy. And they also have for Latino and various throughout in different languages as well. So they're doing great work and it is free. They have a helpline as well. And so I always say stopping stigma starts with you saying there's no reason to be embarrassed or ashamed. If you have someone or you know someone or a family member who has an issue or you have an issue, seek the help that you need because it's out there and it's available for you. Okay, great.
Question, actually, if you don't mind. Do you have any suggestions for offering techniques or strategies for organizations to implement mental health best practices for their employees?
That's a good question. I mean, I think that wellness initiatives has permeated a lot of work cultures. I think we live in a high stress environment, and I think
Yeah, because there's kind of like two ways, right? Like it's about showing, appreciation and helping people feel a sense of worth, right? That's kind of like the supervisory like work culture. But then a lot of companies contract for employee assistant programs. A lot of it, you should check out at your company what programs their EAP, because sometimes they may have STEM seminars about wellness. I've seen some companies just want to, it's kind of like, how do you support others? But then it also is, how do you kind of stomp out stigma at the same time? Some companies will engage in like mental health first aid, but that's more about like, how do you support colleagues? But I think there's always that secondary gain of like, when you're thinking about it and how do I support somebody that may be going through something, you're also kind of learning what those wellness techniques. And again, like, it's okay to not be okay and be able to talk about it. So I've seen those, but I would check out also what your EAP programs have, because they may have a whole array of wellness or mindfulness activities that may be offered to your company. Typically, like at the work level, you'll see more like mindfulness, kind of like the exercise that we did starting in the beginning of this call, like just kind of having that moment and bringing the pressure down, the temperature down a little bit.
Great, thank you.
Yes, thank you so much. So we have one additional question, which is how can we distinguish between symptoms of dementia and other mental health issues?
You know, I think you need an evaluation by a professional, you know, and which includes a thorough medical evaluation. Sometimes it's impossible to distinguish just by talking to a person on one instance, you know, because sometimes when someone is having problems, it's a result of an infection, and they have a urinary tract infection, they have a thyroid problem, or sometimes it's as a result of something progressive like Alzheimer's disease. So I would say the important thing is to connect with your medical doctor and have a thorough evaluation that includes lab work and might include imaging and also includes testing of a person's memory and other facets.
Great. Well, thank you so very much. Once again, to Dr. Garcia and to Karen Leonard, we thank you so much for being here today.